Have you ever wondered what your body is trying to tell you? Just like a well-tuned machine, our bodies send us signals when something is amiss. These signals can often be the first indicators of potential health issues. In this journey of understanding our own bodies, we'll be exploring various signs that your body could be sending you. From changes in urination patterns, which might be a sign of kidney issues or metabolic conditions, to swelling that might indicate heart or kidney disease. Fatigue and weakness can be your body's way of telling you about underlying issues like anemia or hormonal imbalances. Shortness of breath, skin changes, high blood pressure, gastrointestinal symptoms, and even changes in appetite can all be signals that something's up. Recognizing these signals is the first step towards taking charge of your health. First off, let's talk about changes in urination patterns. The urinary system, encompassing the kidneys and bladder, plays a crucial role in maintaining our body's fluid balance. It filters excess fluids and waste products from our bloodstream, which are then expelled as urine. Now, if you start to notice an increase in how often you're running to the bathroom, or if there's a shift in the color or even the smell of your urine, your body might be trying to tell you something. These changes could hint at a disruption in your kidney function. They might also be symptoms of a urinary tract infection or UTI. And let's not forget metabolic conditions like diabetes, which can also cause changes in urination. So if you've been noticing changes in your urination, it might be time to see your doctor. Now, let's move on to swelling and fatigue. Have you ever noticed your ankles, legs, or abdomen looking a bit puffy? This could be a sign of edema, a condition where fluid accumulates in tissues, causing swelling. It might be a result of heart or kidney disease, where impaired circulation or fluid retention leads to fluid buildup in these areas. On the other hand, if you've been feeling persistently tired or weak, it might not just be due to a lack of sleep. Fatigue and weakness can be signs of underlying health issues like anemia, hormonal imbalances, or chronic inflammation. Anemia, due to a reduced red blood cell count, hinders your body's ability to transport oxygen, leading to feelings of tiredness. Hormonal imbalances or chronic inflammation can also affect energy production, leaving you feeling drained. Swelling and fatigue shouldn't be taken lightly, as they could be signs of serious health conditions. Have you been experiencing shortness of breath or changes in your skin? These symptoms may be more than just a passing issue, and could be signs of underlying health conditions. Let's first consider shortness of breath. This symptom, also known as dyspnea, can be a result of respiratory, cardiovascular, or metabolic problems. Imagine struggling to breathe after climbing a flight of stairs. Now imagine that struggle happening while you're simply sitting or lying down. This could be due to conditions like asthma or chronic obstructive pulmonary disease, where your airways are narrowed or inflamed, making it hard to catch your breath. Or it could be a sign of heart failure, where your heart doesn't pump blood as well as it should, leaving you gasping for air. Even metabolic conditions like anemia, where you don't have enough red blood cells to carry oxygen to your tissues, can lead to breathlessness. Now let's talk about changes in your skin. Your skin, the largest organ in your body, can be a window to your internal health. Alterations like jaundice, where your skin and the whites of your eyes turn yellow, could be a sign of liver dysfunction. This happens when your liver can't process bilirubin, a byproduct of old red blood cells, leading to its accumulation in your body. Rashes, on the other hand, could be an indication of autoimmune disorders. These occur when your immune system mistakenly attacks your own body. Conditions like lupus or dermatomyositis often present with characteristic skin rashes. Similarly, unexplained bruising could be a sign of issues with blood clotting. This can happen when your body doesn't produce enough platelets, cells that help your blood clot, or when these platelets don't function properly. If you've been having breathing difficulties or have noticed changes in your skin, don't hesitate to consult a healthcare professional. Let's now discuss high blood pressure and gastrointestinal symptoms. High blood pressure, or hypertension, is more than just a number on a chart. It's a sign that something isn't quite right in your body's vascular system. Abnormalities in blood vessel function, fluid balance, or hormonal regulation can all lead to hypertension. Imagine your blood vessels as a network of highways, with your blood as the cars. When things are running smoothly, traffic flows easily. But if there are issues such as dysfunction in the lining of the blood vessels, or stiffness in the arterial walls, it's like a traffic jam causing pressure to build up. Similarly, if your body isn't regulating fluids properly, or if there's an imbalance in hormones that control blood pressure, it can be like adding more cars to an already congested road, again increasing the pressure. This heightened blood pressure poses a risk for cardiovascular complications, such as heart disease and stroke. On the other hand, gastrointestinal symptoms like nausea, vomiting, diarrhea, or abdominal pain can signify issues within your body's digestive system. These discomforting symptoms may be the body's response to gastrointestinal disorders, infections, or inflammation. Consider your gut as a busy city, with trillions of bacteria making up its population. Imbalances in this bacterial community can disrupt the city's order, leading to digestive disturbances. Similarly, damage to the gut's protective lining or mucosal layer can be like a city under siege, causing symptoms like abdominal pain or diarrhea. Functional gastrointestinal disorders, which are conditions where your gut looks normal but doesn't work properly, can also manifest as these symptoms. In both these cases, your body is trying to tell you something. Lastly, let's talk about changes in appetite. The rhythm of our hunger is not simply dictated by an empty stomach. It's a complex dance of hormones, neurological signals, and metabolic processes. When these elements are in harmony, our appetite remains balanced and predictable. However, when a discord occurs, we may notice fluctuations. For instance, hormonal imbalances such as those seen in thyroid disorders can lead to increased or decreased hunger, or perhaps disruptions in neurotransmitters, which are often evident in conditions like depression, can drastically affect our appetite. Even metabolic changes like those seen in diabetes can have a profound influence on our hunger levels. In conclusion, understanding these bodily signals can empower you to recognize potential health concerns and seek appropriate medical attention. Remember, regular health screenings and lifestyle modifications are essential for managing and preventing the progression of underlying diseases.